What if your constant fatigue and joint pain were signs of hidden inflammation and testosterone was the missing key to reverse it? Most doctors, they never mention this, but today I'll show you how testosterone replacement therapy, or TRT, could change everything for you. Stick around to discover the truth about testosterone and inflammation and what you can do to reclaim your energy, reduce your pain, and live at your peak. Now, I'm not a doctor, but I am an early TRT patient with personal experiences with this therapy dating back to 2017, when I would describe it as taboo to be open about testosterone replacement therapy. Nobody was talking about it. I'm also the founder of a healthcare company focused on holistic, whole body health. And unlike the traditional medical approach, which often treats symptoms, we dig deep into root causes, things like hormonal imbalances and inflammation and nutrition and lifestyle. And further, to make sure that we're on the right path, we use diagnostic tools like DEXA scans and lab tests to get precise insights into what's actually happening inside of the human body as we progress. And I've also personally experienced the power of natural methods and optimized health through a holistic approach. And as a result, our team has years and years of experience in fine-tuning things like hormone replacement therapy to help people just like you look so much better, not just better on paper. So here's what I think that you should be considering. Chronic inflammation is a massive issue that definitely contributes to fatigue, joint pain, and countless other problems, including disease states. According to the Journal of Clinical Endocrinology and Metabolism, low testosterone is associated with higher levels of pro-inflammatory cytokines. And those are molecules that promote inflammation in the body. And these cytokines, they include things like IL-6 and TNF-alpha, which are linked to conditions like rheumatoid arthritis, super scary, cardiovascular disease, and even things like depression. Not just inflammation. Research published in the American Journal of Physiology shows that testosterone can help reduce insulin resistance in the human body, and at the same time, improve muscle repair and support recovery, which are all essential for feeling energized and alive and keeping your body in top shape. In fact, it was found out that men with higher testosterone levels have significantly lower levels of C-reactive protein, that's CRP, a key marker of inflammation. So if you're dealing with constant pain or constant fatigue, it could be that low testosterone is silently fueling the fire. That was my personal experience. So let's get real for a second. Imagine I stay on the path that you are right now. What if nothing changes? I don't change anything. And you wake up every day feeling sluggish with that dull ache in your joints, pushing through the day with barely just enough energy to get by. Maybe that sounds too familiar. And you miss out on activities with your family or your friends, or even simple tasks start to feel like they're a burden. I can describe it like that because I know I've been there. And over time, this low-grade inflammation can turn into many more serious health issues like diabetes and heart disease, or even mobility problems that limit your freedom. And here's the kicker. This constant inflammation is aging you faster. Every year that goes by without addressing it is a year of lost potential for you. So the question is, how much longer are you willing to put up with this state you're in? But here's the good news. There's a way to address this, one that goes beyond symptom management. Testosterone replacement therapy, or TRT, combined with, of course, lifestyle adjustments, diet adjustments, they can help you reduce inflammation, restore your energy, and get you feeling like your younger self again. And I'm not talking about a quick fix here. I'm talking about a long-term solution that actually gets to the root of the problem. Stick with me here, because in a moment, I'm going to show you exactly how TRT and a holistic health approach together can bring you lasting relief and renewed vitality. So we're going to walk through all of the actionable steps that you can take today to get your life back on track. But if you're ready to take the next step on your health journey, subscribe to our channel and join thousands of others who have already begun to tackle health and fitness concerns like sex hormones. And together, we can help you build the knowledge and confidence to make smart and healthy decisions to help you achieve your goals. And remember, I'm right here with you doing the same things. So I remember working with a client named Mark, guy's in his mid-40s, successful career, but he was struggling with chronic fatigue. He was struggling with joint pain, brain fog, and it wouldn't go away. He tried everything, diet changes, supplements, even different types of pain management drugs. And nothing seemed to help. The drugs helped, but then he was on drugs and didn't like the rest of his life. So after we did some thorough lab testing, we found that his testosterone levels were well below optimal, like an old man. We put him on a customized TRT plan and worked with him to optimize his diet and exercise regimen. And within a few weeks, he noticed massive differences. More energy, less joint pain, better focus at work. And 6 months in, he was a new man. His inflammatory markers had dropped, and he felt strong and clear-headed and full of life again. And that's the power of addressing the root cause of all of those symptoms he was experiencing. So let's tackle some concerns that you have, some questions about TRT and inflammation. The first one, the one that I always get, is the question, is it safe? When managed properly and under medical supervision, TRT is generally very safe. Just be sure that your clinician is doing frequent lab tests on your hormones, especially until you're optimized, especially in those early stages. Our team does frequent lab tests at the beginning, sometimes even weekly, but mostly monthly, and then it moves to quarterly thereafter. Next question, won't testosterone make me bulky or aggressive? And testosterone, it does help a lot with muscle mass and energy and bone density, but it doesn't turn you into a monster. It doesn't turn you into a bodybuilder unless you are specifically training for that and you're doing other sorts of drugs. And most people just feel healthier. They feel more balanced. And as for aggression, there's just no evidence that TRT increases aggressive behavior when it's dosed appropriately. And that's the key part of this. It has to be dosed appropriately. How long does it take to feel the results? And you might start actually noticing some changes within just a few weeks, but the full benefits, they can take a few months. So consistency and regular checkups is key. Another question I get all the time, can I just take supplements for testosterone? And supplements, they can help if you're borderline, but if you're significantly low and for a long period of time, they won't replace what your body truly needs. TRT is a more effective option for restoring optimal levels. All right, so let's get into what you can actually do to get started on this journey. Get comprehensive lab testing. You have to get your labs tested. Find a qualified practitioner who will run a full panel on your hormone levels, including total testosterone, free testosterone, estrogen, and inflammatory markers like HSCRP. You need a clear picture of where you're starting from. And definitely work with a practitioner for a customized TRT plan. So if your testosterone is low, talk to a practitioner about TRT. Look for someone who's going to monitor your levels and make adjustments as is needed over time. You have to engage with a practitioner. Subcutaneous injections, by the way, are often a good choice for delivery as they provide more stable absorption. And that's how I do it and most of the Stark students. That means injecting right into the fatty tissue, not into the muscle. You also have to implement an anti-inflammatory nutrition and lifestyle changes along with it. So you've got to support your TRT with anti-inflammatory foods like leafy greens, berries, healthy fats, high quality protein. You've got to avoid processed foods and make sure you're managing stress. Stress is a huge inflammation trigger. And of course, you have to prioritize sleep and recovery. So this isn't a singular tool. You can't do TRT alone and hope you're going to experience massive changes. It has to be a part of your entire health and wellness program. It's merely a part. So if you think back to when you were younger, testosterone was in your body, and you may not have been the fittest 16-year-old in the world, or the fittest 20-year-old in the world, or like me, the most amazing 24-year-old in terms of my physique. I just wasn't that guy. I had the tools in the toolbox, but I wasn't doing the other things at the same time. If you're a bit older than that and TRT is appropriate for you, you'll just go back to where you were in terms of your ability when you were younger. You still have to do the things that take the work: nutrition, lifestyle, stress management. And of course, you have to recover. Poor sleep can absolutely tank your testosterone levels and can increase your inflammation. So you've got to aim for 7 to 9 hours of quality sleep and avoid screen time before bed. This is absolutely critical for recovery and just general hormone health. And then you've got to track your progress and adjust. Keep an eye on your energy levels, your pain, and your mood. Regular check-ins with your practitioner will help fine-tune your plan to maximize the benefits that you want to get from TRT over time. And at the end of the day, chronic fatigue and joint pain do not have to be a part of your life going forward. There's signals from your body that something is off, and testosterone may be the key to unlocking better health and vitality. So don't let the traditional system make you think that you're stuck feeling this way, because you may not be. Maybe you just need to be tested. So now that you know more about how TRT impacts chronic inflammation, it's time to take your health to the next level. If you're really serious about maximizing your longevity and maintaining peak performance over long periods of time, make sure you watch this next video, because it shows how and why heart meds often fail and how to improve your cardiovascular health. And of course, as always, get your free training at watchtodd.com. That's watchtodd.com. You'll be glad you did.